Hi, my name is Emma Osborne, and this is my Sports Medicine 3 project on medical research behind dementia. I focused on what dementia was, the types of dementia, and the new hope that science has discovered about treatments of dementia. The reason I chose this topic was because my great-grandma has recently been diagnosed at the age of 98 with dementia, and I wanted to learn more about it. The term dementia is used to cover almost any symptom resulting in memory loss, the inability to perform daily tasks, and the deterioration of communication skills, which makes the term dementia very broad and up for interpretation. This is why there are so many different types of dementia. There are types ranging from Down syndrome dementia to Alzheimer's disease, mixed dementia, Huntington's disease, and Parkinson's disease dementia. But I will be focusing on the three most common types of dementia, which are Alzheimer's disease, vascular dementia, and Lewy body dementia. I will be starting with the most common form of dementia, which is Alzheimer's disease. Many people are under the assumption that Alzheimer's disease is a separate disease from dementia, but in actuality, it is a form of dementia. The main symptoms behind the disease is losing train of thought, difficulty staying focused, having trouble finding the right words, feeling overwhelmed, and problems planning. Almost 5.5 million people a year are diagnosed with Alzheimer's disease. The second most common type of dementia is vascular dementia, which is the decline in thinking caused by conditions that block or reduce blood flow to the brain, which deprives the brain of oxygen and nutrients. This can be caused by things like blood clots and strokes within the small vessels of the brain. They are also called a stroke-related dementia because of this. The third most common form of dementia is called Lewy body dementia, which is personally the most interesting for me. It is a progressive dementia that leads to a decline in thinking, reasoning, and independent function, and it is caused by abnormal microscopic deposits that damage the brain cells over time. Lewy bodies are also the cause of DBL and Parkinson's disease, which means that people with both of these diseases are at higher risk of developing a form of dementia. While dementia is a very hard and horrible disease to go through, there is still definitely some hope for the future because of scientific research. Starting off first with things like hydration gummies, meant to combat dehydration caused by memory loss in people with dementia. These may seem not that important, but for people with dementia, basic human needs are commonly forgotten. One of the great new things that have been developed is a new blood test that can diagnose Alzheimer's disease early than any of the previous brain scans method that we used to use. And this method also is within over 94% accuracy. This will definitely help treatment start early for Alzheimer's patients. Next is the discovery of new types of dementia so that we can directly target specific genes and types of dementia with new treatments that we come up with. The newest type that has been found is called late, which is caused by a buildup of a toxic protein called TDP43. Also, new research centers around the world have been popping up to find new and improved treatments as well as help take care of patients with dementia. These new treatments can be seen in the approval of a drug that may slow down the progression of Alzheimer's disease, as well as an anti-amyloid drug. On the treatment standpoint, there is a new gene therapy as well that will help target specific genes that are connected to some forms of dementia and help prevent them in future generations. All in all, this was a great presentation to work on because I got to work on a topic that was very prevalent in my life, and I got to see what my great-grandma was going through and why this was happening to her. And that concludes my presentation on medical research on dementia.